Hi, I'm Dr. Dhanraj Budhai. I'm the lead dental surgeon with Smile Designers, and I'll be sharing a few tips with you guys today. So one of the things I want to talk about today is how to identify that you may have a bad tooth, or what we call a tooth decay or a cavity. Firstly, you need to understand what a healthy tooth is. On a healthy tooth, you can see the outermost layer, which is the enamel layer. That's the hardest substance of the body. It's the most mineralized It's the most mineralized layer, and it protects everything that's within the tooth. The second layer is a dentine layer, and that's a layer that's usually very sensitive. And just below the dentine layer, we have where the nerve and blood vessels are. When you have a cavity, something like this happens. But this is a really bad stage. I'll show you another demonstration of how it usually starts and what it leads to. This is normal tooth structure. We have our enamel layer or dentine layer and then the nerve in the middle, okay? Now, as you have a cavity or as you get cavities, the cavity is basically tiny holes that forms on the tooth when you don't take good care of it, and that leads to exposure of the inside layer of the tooth. That's the dentine layer. Now, when that is exposed, you can easily identify that if you have any shocking or any sensitivity, or if you have food getting trapped in those layers. And if you do have that happen, you should visit your dentist as soon as possible, because if you don't, what usually tends to happen is that the cavity gets bigger, of course. And as the cavity gets bigger, that cavity can extend all the way into the nerve and blood vessel, and at that point of time, a fill-in may not work, and you may need additional expensive and very difficult treatment. So you should visit your dentist just to check and see what's going on. With that, I'm Dr. Dhanraj Budhai, and I leave you with that tip today.